So, in the weeks since all this began, we've been working tirelessly or tiredly to do everything we can to make sure, first, that our patients in the hospital and our staff are safe and well cared for, and also to make sure that our patients coming into our clinics are safe.
So the emergency department at Kittitas Valley Healthcare is always in a state of readiness. We are ready for any type of patient surge, whether it be a motor vehicle crash, an icy wintry morning, but usually those events are short-lived and timed out pretty quickly. This, on the other hand, is very different. We don't know when that surge is going to happen, and we don't know for how long we need to be prepared. So when we found out about COVID-19 towards the end of February, beginning of March, we reached out to all of our partner organizations in the community, including EMS, Public Health, CWU, and began making plans. The hospital came together and we had our incident command set up very quickly and started figuring out what do we need to do to support our community with COVID-19.
One of the things that we are seeing is that people are coming into our emergency room sicker because they were afraid to get care, and they're having worse outcomes as a result. We're doing a lot so that when you get the care that you need, you're safe, but you need to get the care that you need.
So for the emergency department, we first started with just good communication to the staff. We let them know what we were doing, what was coming, what was happening from a state and a national level. We looked at our current operations. How could we better serve our community? We reorganized our rooms. We took our isolation cart and stocked it up, put it in a more central location. And one thing with emergency departments, we learned that things change daily. And we are willing to change our plans accordingly, depending what comes towards us. So our tent was set up to mainly be a screening point. If we do use it, we would staff it with a trained emergency department nurse. They would do a medical screening exam on all patients. It's a very quick exam, basically seeing where is the best place for this patient to go. It might be across the parking lot to the COVID-19 clinic, where we would provide a warm handoff to the staff there. It might be right there in the tent and we bring a provider out that can assess the patient, take care of them, treat them, and we can keep them out of our hospital. We planned on different pathways for patients, so whether they were exhibiting respiratory symptoms or not, trying to keep patients cohorted in the proper areas. We mapped out 2 different waiting rooms, 2 different paths into the emergency department. And if our patient load became so large that the emergency department needed more space, we are able to overflow into our surgical outpatient with staff, and we can have up to 12 more rooms. So another thing that we did right at the beginning of this was have communication with our EMS providers, both Kittitas Valley Fire and Rescue and Medic One from Upper County. We came up with a plan where if they do have a patient that has respiratory symptoms and is a potential COVID patient, that they're calling us ahead of time. That gives us the heads up to prepare the room. And then when they do arrive at the hospital, if we don't see them drive up, they do give us another call, and we come out and actually meet them either outside or in our ambulance vestibule to have the transfer of patient care there. We've also set up a cleaning station for them so they're able to decontaminate their equipment and their ambulance without having to come back into the emergency department. That was one thing that's very important, is that we have that heads up for those patients so we can have a seamless transfer of care, keeping everybody safe. The hospital made some very tough decisions early on about limiting visitors, and we all know that that is very hard to not be with your loved one when they're in the hospital. We are doing our best to communicate with visitors. We ask for phone numbers. We call them frequently, and we tell them they can call us to check on their loved ones, but we recognize how hard it is to not be able to visit your loved one. We understand if you can't be at the bedside, and we're going to do the best to provide the care and let your loved one know that they're not alone.
We've restricted the number of visitors. We've reworked traffic flows to try to keep people who may be infected with COVID away from people who aren't. We're trying to keep each other safe. We're also recognizing that the same diseases that existed 12, 14 weeks ago still exists today. We still take care of people with diabetes, with heart problems, people who need frequent blood tests to make sure their blood thinners are dosed correctly. We have to keep them safe, and we're doing that. We are asking our employees to wear masks, to monitor themselves for new symptoms. We're taking our temperatures twice a day, before and after work, and we've got this. We'll take care of you.